Welcome everyone. We will be going through a couple of Contura cases today. There's a simple one which we will do first, we're doing right now, and we will go through all the contouring and a little bit of the optimization and evaluation stuff. In this case, there's a more complicated and challenging case that will be a separate recording, and you can find that later. Now what we've done so far is that we've imported the case and we've allowed Brachyvision to auto-contour the external contour, which in this case it's done fairly well. The first step that we're going to go through here is to look at all the contouring steps for all the structures of interest. And you can see the structures listed here. We've already created those as a structure template so that they'll be created in the same way every time. Now, those structures that you use in a clinical case depend in terms of their definition and exactly where the boundaries are and so forth. That is a matter of clinical judgment, and so that has to be done in conjunction with the radiation oncologist, because every radiation oncologist will have a slightly different style in terms of how they define those structures. So you should consider this to be an example and more or less the processes that you would go through, not necessarily the exact definitions you would use in any particular case. Now we already have the external contour, as I said. The next thing really for us to do is to contour the applicator itself, and I've defined that here as applicator. So let's get started with that. Let's zoom in on it a little bit so that we can see it better. And you may want to adjust your window and level settings generally so that you can see the balloon very well. This is fairly tight window and level setting, but in this particular alone for the moment. Now, there are a number of different tools you can use for doing the applicator. The one that I like the best for Contura, since they tend to be extremely round, is to go to the contouring menu, draw ellipse. And this has a very nice tool that will allow you to draw an ellipse very easily. Let's start up near the superior end here, and the way the ellipse tool works is you click and drag, and that gives you a diameter. You let go of it, you have a circle, and if you move the mouse beyond that, you can change the aspect ratio of that circle to make ellipse. And if you click on it or move to another plane, it's set in stone. So let's move down. Generally, you can do this about every second slice, and it doesn't matter whether you start with a vertical, horizontal, or oblique diameter. Just use the one that allows you to see the diameter the best. And there will be some cases where you have air inside the balloon, and if that's the case, that'll be always at the anterior margin, and that means that you will not want to draw from top to bottom because you can't see where the balloon edge is. And you can see that right here. So that's why I generally do these in more or less an oblique fashion, like this, and it'll draw the balloon edge correctly when you do that. Now you can see that there's air in the balloon here. Whenever there's air in the balloon, it'll always be on the anterior surface, and you'll see this air fluid level. It's also possible, of course, for there to be some air outside the balloon. In this case, that's not the case, but it appears to go outside where the balloon is. That's a bloom artifact because of our window and level settings. If we were to set a very wide window, say 4,000, we eliminate the bloom artifact, although things are not as easy to see, but you can see here that when we set it that way, this air bubble is all inside the balloon. I'm going to go back to where we were, which is about 1,000, a typical setting. So let's continue with this. And if you miss a little bit the diameter, we can come back and move some of those later, which I will do. We can do this one. Now when you get towards the end, you can see that there's quite a bit of partial volume effect here, and so it's a matter of judgment exactly where you draw this. There's probably nothing still showing there. Now on one of these, like this one, you can see that we didn't get exactly the right diameter, so we'll use the Move Contour tool here, and we'll bring that in, and we'll just fix that one up to be correct. And let's step up and down. This one also needs it. The rest of these are pretty good. So once we get those the way we want them, then we'll interpolate the ones in between. And for a balloon, I prefer the cubic interpolation, although it doesn't really make a lot of difference. So once we do that, we'll just scroll up and down to verify that we've got about what we want. That looks like a pretty good balloon. So I'm just going to save that so we can go on. The next thing to do is perhaps the air around the balloon. Now, we don't need to be concerned about this because it's in the balloon, but let's draw this portion. And for that, I tend to use the pencil tool because these are fairly small and the automatic tools don't get them very accurately. And since there's not that much to draw, it's pretty easy. Now, if you want, you can draw it rather sloppily at the balloon margin and make sure that it goes inside the balloon when you do that, and then you can subtract the balloon from it to get a nice clean edge there. But in this case, it's not so hard, so we won't bother. And you can draw this either in a continuous mode or a point-to-point mode, and you'll see that when you let go of the cursor, it changes just a little bit because of the way it's stored internally. It's not going to be perfect. It'll never be perfect because of the resolution of the CT. But that's just part of the game here. Like that. That one's too small to even be shown. Go down a little farther here. I like the point-to-point better myself because I'm not that steady in the hand. People who do this all the time may prefer to use a continuous mode. There we go. So you turn off that tool. We may want to check its volume right now. You can check the volume of any of these by right-clicking on it and then move down to measure volume. We have 0.65 cubic centimeters in this volume. Now, if we're going to treat this case, we want that to be less than 10% of our ultimate PTV eval. And in this case, it's going to be so small that we don't really need to show that. Okay. The next thing to show is the chest wall. I'm going to make this a little bit smaller here. Now, when I draw the chest wall, the reason is that I want to limit the PTV to only breast tissue. And you can see here that we have the ribs, the intercostal muscles, and this is pectoralis major muscle here. So when I draw the chest wall, I'm drawing that as a structure not to be evaluated, but only as a substrate to build other structures on. And so I'm going to do it in a very simple way. So what I will do is I will draw the chest wall in over the slices that contain the balloon and a little bit above and below, and I will include in that the pectoralis major muscle because we want to limit our PTVs to only breast tissue. So this is not a real anatomic structure, it's just kind of a crutch. And the easiest way to do that is to use the brush tool. I usually select about a 4 centimeter static brush for this. And then you can just draw it by dragging it along that margin. And you can see that I've included some stuff here that this is breast tissue down here, but I've wanted to include all of the pectoralis muscle here. You can imagine perhaps that if we're expanding a PTV beyond here, we don't really want PTV down here beyond the pectoralis muscle anyhow. We do this in a simple way, make it fairly thick, and we just let it run wild on the opposite side. And we really only need to do this on about every third slice because the planning system can interpolate it quite well. That's what I'm doing here, about every third slice. You'll also notice that I've chosen a color for this that is a light color. I want to reserve my dark colors for the structures I'm going to use for DVH evaluation later on because the DVHs, I want the DVHs themselves drawn in a dark color because I like to use a light background. That's a matter of personal preference. And I'm going to make sure that I get far enough beyond here that when I generate some of my odd structures that I'll get to in a bit, that I have enough of this to stop them from being generated in places where I don't want. So at the superior margin of the balloon here, so that's all the drawing we need. I'll go back toward the center here, pick a slice where it's not drawn. Now we're going to interpolate that as well, and we can just use the default linear interpolation here. But then you'll always want to check, of course, to make sure that the ones that have been interpolated in between make good sense. In this case, it does a pretty good job, so we don't worry about it. Now, since we're not going to evaluate this structure and it's not anatomic, it's only there to generate other structures, once we draw it, we can turn it off. We don't need to see it anymore. So when we start with the other structures, like the PTV surface, which is the next one, that won't show, but it'll be there for us to use. Now the PTV surface, I like to make two PTVs. One of them is purely for optimization, and I call that PTV surface. I'll show you why in a minute. And I create a separate one for PTV evaluation. That's for the DVH evaluation, and that one is consistent with the B39 definitions. This PTV surface is only for optimization, so it's a little bit special. So the way we create this is we select it first, and then we take the margining tool, and we're going to create a margin from the applicator. In this case, an outer margin symmetric is fine. We'll set that at 1 centimeter, and now we're going to set that to avoid the chest wall. And we'll go ahead and create it. And this is what it looks like. You can see that it stopped the PTV posteriorly here at the chest wall. I'll scroll up and down a little bit. Now generally, we will want also to limit this to 5 millimeters from the skin. And the reason is that we're going to use this for optimization, and if it comes too close to the skin dose will get high. And we can, by limiting it to 5 millimeters from the skin, we inherently reduce the dose to the skin. Now, it may be that in a particular case, the physician will want their PTV eval to go closer to the skin than that, because that is their personal style, or because in a particular patient there's a close margin there. You can do the PTV eval different from this one if you want to. I won't in this particular case, but you can do that if that's the physician's preference. Even if you do that, though, this one I recommend you keep it 5 millimeters away from the skin in order to inherently drive the optimization to keep the skin dose low. So this structure is just the way we want it now. It includes the balloon and a centimeter of tissue, but does not include anything that's not breast tissue here. The next one is the PTV eval, and since I'm going to make it with the same definition in this case, I can just right-click on the surface one, copy it, then right-click on the PTV eval and paste the structure over structure. So that means that the PTV eval is now identical to the PTV for surface. The only remaining thing to do is to remove the balloon. And I do that using the crop tool. You can also use the Boolean operators, but this is a shortcut that's a lot easier to use. The crop structure we're going to do is the PTV eval, and we're going to remove the part that extends inside the applicator, and no additional margin. I just hit a return there, and this is what the PTV eval then looks like. In this particular case, it's flattened on the posterior margin because of the pectoralis muscle, but it's a centimeter away from the balloon everywhere else. So it's a fairly simple case. So we have those two. The next structure to be concerned about is the ribs. Let me turn the PTV eval off and the surface off here so that they're not in our way. The ribs we would like to do, now what we will do here is do the bony ribs only, because the primary reason for knowing the dose to the ribs and limiting that is the risk of rib fracture. And most observers believe that that's due to the dose to the bony ribs. Some clinics would prefer to include all of the chest wall, the intercostal muscles as well, because they're concerned that it's the blood supply, which is just underneath each rib, that causes the rib fractures. We don't know that for sure. In this case, we're going to illustrate just the bony ribs. Now, the easy way to do this in Brachyvision is to use a contouring wizard, but first we need to set a bounding box that doesn't contour the whole body. And you can see I put it on here, and I'm going to move on these auxiliary views so that we're not contouring things way outside our region. That and that. And you can see in this view that we're limiting that. I'll do a few more limitations in these views. like that. I probably want this farther out here, so that I get this rib, and I want a little bit farther posterior so that I get all the ribs that are likely to get high dose. Now when we do the DBH of the ribs, we're really only going to look at the maximum dose in the ribs. So if we miss some of the rib structure, that's okay, as long as we have gotten the location that's going to have a high dose point. So we'll go to contouring here, and we'll select the segmentation wizard, and they've got a special one for bones, and we'll just take that and we'll let it run. Now there are a few problems with this, and you can see one of those immediately is that it's included also the balloon. So the simplest way to do that, to get rid of that, is just to crop the balloon out. We're going to crop the rib structure here. We're going to remove any part inside the balloon with 0 margin, although there's a little bit of stuff here. So I'm going to take just the eraser tool, I've still got this set at 4 centimeters, and erase all the other little pieces that I see. You'll see that outside, and if there are surgical clips, you'll oftentimes get those in the volume as well, and you want to get rid of those. You can see that it hasn't gotten all of this rib, but it's gotten the anterior surface, which is where the high dose is going to be, and that's really all we're going to be looking at. So that's okay. We don't have to worry about that. But do be careful that you don't get also things like surgical clips. They won't make a big difference, but a little bit of stuff around the balloon here will scare you, because you get very high rib doses if you include that as part of your rib structure. Here's a surgical clip that's in the axilla. Now, that wouldn't honestly make too much difference in terms of your dates because it's so far away. Okay, so the ribs are done. We're done with that part. Now, in order to evaluate the dose to the skin, B39 has limits on the skin dose, and the B39 definition is the maximum dose at the skin-air interface anywhere. And so we don't want to create an internal structure that is like a skin organ. What we want to do is to detect what the maximum dose at this interface is. And the simplest way to do that is to place a large margin on the balloon, let it expand outside the body, and then subtract the body from it. And we'll get a structure on the outside that is in intimate contact. So let's try that. And I call that skin max. So tell myself that this is only for evaluation of the maximum dose. This is not the skin. This is a separate structure. So we're going to do that. The margining tool again. We'll margin from the applicator. This time we'll use a 3 centimeter margin and no avoidances. Structure here that extends outside the body. We'll use the crop tool again to do the skin max, and we're going to remove any part extending inside the body with 0 margin. And so here's our skin max structure. If I scroll up and down, you can see that that's in intimate contact with the skin over the region that we're concerned about. So that will definitely identify the maximum dose in this volume is also going to be the maximum dose to the skin. And that's also consistent with how you would actually measure this. PLDs on the skin to be just outside the skin here. This is exactly correct. And again, since this is not an anatomical structure and it's not useful for anything else, we don't need to visualize it. So we'll turn its visualization off and leave it off for now, because we don't ever need to look at that structure. It's not real. Now there is another structure for us to be concerned about. Let me put the PTV eval on here. In the PTV eval, the high doses that are in the treatment volume will extend out into this region, but we're going to evaluate at some point the V150 and the V200. These are parameters that were identified by David Wazer a number of years ago with respect to interstitial brachytherapy that relate to the development of fat necrosis. And so we want to know if there are excessive volumes of breast tissue in particular that go to doses of 150 or 200% of the treatment dose. Now, normally we can do that evaluation on the PTV eval itself, because the 150 and 200% isodose lines will typically be inside this envelope. In the case where we've cut it off posteriorly here, that doesn't matter because that's not breast tissue anyhow. But in the case where we've limited it a little bit due to the skin, we can have areas of breast tissue that are outside the PTV valve. So it's good practice to have another structure to evaluate the V150. Now some people would want to do the entire breast for that, but since we're only looking at the high dose volumes just around the balloon, we don't have to be quite that assiduous, and that's a lot of work trying to get the whole volume. Also, we want to make sure that we eliminate this part, which is the chest wall. So we make a special structure, and I call it the V150 structure. And again, we'll do that by margining from the balloon. So we'll take the margin tool, margin from the applicator, and I would set this at about a 2 centimeter margin to make sure that, that we get everything. And I will again avoid the chest wall and create that structure. Now, if it goes outside the body, in this case it does. So if it goes outside the body, we'll want this structure to go right up to the skin line. So when we do the crop, we're going to crop the V150, remove the part extending outside the body, but the default of 5 millimeters we're going to get rid of. So unlike the PTV eval, this one gets cropped only at the skin line itself. So and again, this is not an anatomic structure. We don't need to show it once it's defined. We will be using it for DVH evaluation later on, especially in the more challenging cases. So we've got all of the structures properly contoured here. It's time to save, and we'll go on next to the planning phase. Okay, the next phase is to reconstruct the channels of the applicator itself. I've already set up the windows to get the applicator pretty much centered up. I like to keep these sliders very much near the center until the very end, and we only use those for very minor adjustments. But I use this panning tool first to get the applicator in the center of the windows and to reset these sliders. When you zoom in, everything will go funny here. Now what I will want to do then is to rotate the views such that the channels are visible in 2 views. We can get this with the Contura. Since there are 5 channels, it's possible to set up your views so that every single channel is available over its entire length in some view for reconstruction. So I'll go through that, and unfortunately I'm going to have to go through it again, because if you don't do this in exactly the right order in Brachyvision, it resets your views, and I'll illustrate that since I already blew it on that point anyhow. So the first thing to do is to set up the rotation, and what I would do is the view that shows me the orientation the best, that's where I would start rotating. And what I want to do is to rotate this until the central channel is in the center and aligned with one of my other views. So I've rotated this one. We're pretty close. Now I can see I need to rotate this one. So a fine adjustment of position, then I can use these sliders and still maintain everything in the center of the view. The last thing to do, once I've got this aligned in these 2 views, pretty much along the length of the applicator, then I want to go to the transverse view here, and I'll rotate that until I've got 2 of these channels in one view and the other 2 in another view. Now, one thing that we can see immediately here, this is the current model of the Contura, and this model of the Contura on channel number 1, it has a nitinol wire strut just underneath channel 1, and you can just barely make it out here. Let me go full screen with this one for just a moment. You can see right here there's a slight density just below where the lumen is there. That's channel number 1. Now, that'll tell you where channel number 1 is, but you don't know necessarily whether your view is looking toward or away from entry side of this balloon. So you don't know which way around is channel number 2. So the current thinking on this is to place an external marker into channel 2, and that's what you see here. This is a solid wire marker that someone has placed into channel number 2. So we know this is channel 1, this is channel 2, and by elimination this is 3, 4, and number 5 is in the center. So I'll move this back to the center again, and we'll go back to where we were of setting up the views. Now if I go back and rotate this, and if I get it just right, little rotations and little translations here, you can see that in this upper view, we see this channel that has the external marker in it. You can see it goes way out here. Just a plain wire, so this is channel 2, and opposite it, the dark you see here is the air column in channel 4. The other view shows us channel 1 here. Maybe you can just make out this nitinol wire. It's not very prominent, and in some cases the nitinol wire is not prominent enough to even make out, and so you sometimes have to be concerned about that a little bit. But in general, this is channel 1, this is channel 3, channel 2, channel 4, and we can see channel 5 in both views, so we can reconstruct from those. Now, the problem that I have stumbled into, and that you will stumble into the first time you do this, or maybe the first 3 times you do it, is that before I put any applicators in here, I have to create a plan. And when I go to create a plan, which I'm going to do here, I'll insert a new plan. There are a few things I need to put in here. This is going to take, by default, by the way, the PTV surface as our target volume. We can let that happen. It's better than the PTV eval for reasons I'll show you later on when we get to optimization. The technique, it doesn't really matter what you do, but I like to call these intercavitary because it uses an intercavitary approach to the dosimetry. And we will want to put in the prescribed dose per fraction here, which in this case is 340, because you can see my units are set up in centigrade rather than gray. So we're ready to go with that, but lo and behold, it's reset all my imaging locations. So we'll go back through and fix those. So I'm going to just stop the recording until I get back the reverse so I don't have to waste your time. I'll be back as soon as I get that done. Okay, and you can see that I have updated the isodose lines to ones that I find more useful. So the first thing to do is then to start inserting our applicators. Now in some cases you can take the ID of the applicator and give it a meaningful name. And I prefer, for instance, to have channel 1 if possible aimed directly toward the skin, so that gives you the best capability of modulating toward the skin. In this case, it doesn't make any difference, so they haven't bothered. But in the case where you've done that, and number 1 is toward the skin, I'd actually change the name of the applicator to say toward the skin, and the next one to say toward the head, toward the chest wall, toward the feet, or whatever it is. In this case, it doesn't make any difference, just to point that out. So all I have to do is create it, and channel 1 is right here. And now what we want to do, you can see the little plugs here in the channels. We want to start reconstruction from the end of that plug, right there. And in channel, that's channel 2. Here, we're going to start here. So in this case, we're going to start right here. And because we know this nitinol wire is underneath the channel, we're going to try and reconstruct along the darkest part here, which is the center of the air column. So channel 1 we will reconstruct just like this from a template, and have it exactly perfect when you do that. But I'm going to illustrate that my way, which is to reconstruct them every time. Now the other thing that I would say is do not reconstruct it beyond the balloon, because you don't ever want to put dwell positions out here, and some of the automatic methodologies for activating will do that and cause high doses in the tissue here, which is not what we desire. So I would reconstruct it only over the portion of the balloon. So we've got number 1 in there. We'll go and we'll do number 2. Here's number 2 that I tried to reconstruct the first time. Now since this wire is actually in the lumen, we want to reconstruct right over the bright spot there, and to about there. Number 3. And number 3 is going to be opposite number 1 here. We'll start where we can see it. In this view, there's not as good as a visibility in the view above. And that's just because of the way the original images are sliced differently to get this view than this view. And that's just part of the game. Number 4 is going to be right down here. This is a little bit easier than this view. And the reason I mentioned that is because when you get to channel number 5, you have your choice. You can reconstruct it in either view. But I'm going to reconstruct it in this view because this is the view I can see the best. And since that's straight, it only needs 2 points to reconstruct it. And we're done there. So we're done with reconstructing all of our applicators. The next thing that we'll want to do is make sure that they're properly activated. And the simple way to do that is to use this tool, which is to activate inside a structure. We'll fit all the applicators inside the balloon itself, which is called applicator. And you can see that it's reconstructed them, and they're all inside the balloon, which is where we want. At this point, we're ready to go on to the optimization portion. So we'll go to Planning, Modify the Dose, Volume Optimization. Now there are a number of ways to do the optimization. I'm going to show you my favorite. The volume optimization is likely to get you a very good result every single time, and I recommend that you use this primarily. You may want to make some modifications to it by hand later on, but the chances are that you will make some parameters worse when you do that. Now, one thing I want to mention before we start this is that we're going to create some markers that are actually used in the optimization. We're also going to create some markers on this DVH graph here that are not used in the optimization itself, but we create them in this graph so that when we're making the trade-offs, we can see how we're doing. The V150 and the V200 fall into that category. Now, one of the things that I like to do is to start out with a surface optimization. You can do surfaces and volumes at the same time, and that's the reason that we've created this PTV surface structure to begin with, and I purposely name it surface to remind myself that I only want points on the surface of that volume. Now remember, that's the outer surface of the PTV eval. We don't want to put points on the inner surface of the PTV eval because that should have very high dose, and we don't want to do that. So we will create some objectives for this, and I just allow it to create them however they're going to be and then change these values later on. So these are points that are along the DVH, and you can see them here. These are the default ones that just come up. I'm going to set those to be 90% of the volume. And the upper one, we can set that a little bit higher, maybe 30% of the volume. Exactly where this is doesn't matter too much. Also, I'm going to set this one to be 95% of the dose, which is 323 centigrade. And this one I'll just leave alone. So we're ready to go with that. The next is the PTV eval, and we'll create objectives for that also. Now what I will do here is for the PTV eval, the lower one, I want to get 95% to 95%. That is, the V95 will be, we want 95% of the volume to go to that 95% dose level. Now the V39 definition is 90% to 90%, but with Contura we can routinely get better than that. So I'm going to leave the lower one here at 95%. And I'll set this to 95% of the dose. That's partly for optimization, but that's partly also for us to evaluate whether we've got it exactly right. So this is 323. Now for the upper one, I don't really need it. And so what I'm going to do is I'm going to set this upper one, and I'll add an additional upper one to represent the V150 and the V200. Now the V150 and V200 in the original paper by Wazer and in the V39 protocol are identified in terms of absolute volume, and we only have percent to work with here. So the one thing that we need to know is what is the volume of the PTV eval if we're going to evaluate these on the PTV eval, which will work in this case. Now, since I didn't do that, I'm going to have to, I'll say OK to save these and go back, and I'm going to look at the PTV eval here, right-click, and it has a volume of 76 cubic centimeters. Now what I want to do when I go back into my optimization here is that I'm going to take this and I want to set this to be what I think I can get with my V150. Now V39 says 50 cc's, but we can routinely get 30 So I'm going to set that to be 30 cc's, but that's 30 divided by 76 is 39%. So I'm going to set this to 39%, and I'm going to set this to be 150% of the prescribed dose, which is 510. In addition, I'm going to put in a point for the V200, and I do that by hitting the add button. That'll give me a single one here. And I want this to be about 10 cc's. That's what it says in V39. We can do better than that, but I usually set it at about there and then visualize from there. So 10 divided by 76 in this case is 13%. So I'll set 13% here, and I'll set this dose to 200%, which is 680 centigrade. Now you can see over here in the graph that everything's squished up to the left-hand side here because they've got it improperly scaled. But one of the nice features of Brachyvision is you can come into this graph, you can grab a point here with the mouse. I just hold the mouse button down and drag it over here. We want about 700 or 800 at this right margin. That way all of these are where we can see them. Notice also that I've checked Show All Objectives. That shows all these points on the graph, and show all the penalty contributions. So as it's optimizing, it'll show you how much each one of these is affecting the optimization. If it's 0%, that means that one's not violated at all and it's not helping, but the ones that are holding us back will have high numbers on them. Likewise, I also put the error function here. That'll be in this little graph here. It'll show how the error function improves and flattens out when it converges. And we'll show the dwell times. That'll show the actual dwell times in all the catheters. That's just kind of for interest for us. Okay, the other things that we want to know are what is the dose to the skin. So I've got this skin max volume, and I can take volume points or surface points there. It won't make any difference for that. And I'll just set an upper bound there. The B39 says the maximum skin dose should not be more than 145. The Contura registry, they tried to keep it to 125. I would say that we can generally be more ambitious than that in most cases. So I'm going to set the percentage here to be quite low, the very bottom of the graph, and we'll set this to be at about 100%, which is 340. And when I do that, you can see here's the marker for the skin, and we'll want the skin DVH to go to almost 0 by the time it gets here. Oftentimes it'll get a little bit higher, and we'll have to fiddle with the optimization in order to do that. In this case, we're so far from the skin it won't be interesting. It'll die way down here. You can also put the ribs in here in the same way and set an upper objective here, and likewise about 5%, and probably you could put a dose maximum here of about 125%, and that would be about 425. So we can put that in, and this point and this point, this point and this point are not really for optimization. Those are for us to evaluate as the optimization is taking place. So since we're not really using them, I'm going to set their priorities to be quite low. I'll set 10% on the ribs. The skin max I'll set likewise at about 10%. The V150 and the V200, I can set those also at 10%. And then we'll just see what we get. Now, if these become an issue, we can increase their priorities. In general, I don't like to move these markers around on the skin while I'm optimizing, but just to change the priorities. The one exception to that is this V150 marker. We don't have it set at the B39 definition anyhow, and if we push it down a little bit, we'll get a little bit more sparing of V200 as well. The other thing that I try to do is I want to get 95% to 95%, but there's no particular point in going way high above that, because when you do, the V150 and the V200 will always go up. They may be relatively low in any particular case, but we want these always to be as low as possible. And so in order to do that, what I do is I adjust the optimization so that the DVH just goes through the top of this point here, and we get exactly 95% volume, getting that 95% dose. So we're about ready to roll here with the optimization. Let's see what happens. And you can see it moves pretty quickly to something that's reasonable. We're violating our V150 here a little bit. It managed to grab that one. And you can see this is our PVH for the PTV eval, and you can see we have almost all the volume there treated to that dose. I said this is an easy case. So I would say that we're probably over-treating the doses here by sacrificing some of that. So one way to do that is to take this surface, which is actually fairly useful in terms of the optimization, in spite of what some people think. And this lower one, I'll knock that way down, make that 5%, so that we will reduce some of this pull-up here and restart the optimization. It was too easy. Already we're still over-optimized here, so what I'm going to do is I'm going to take this one, and I'm going to increase their weights to try and push that down. So that is on the PTV eval. I'll set this up to 100, and this one up to 100. And you can see that we haven't had to leave the optimization routine to evaluate these points. That's why we have them in there. Well, this case is still too easy. So I'm going to take this guy and I'm going to move him down a little bit because it's just too easy. You can see that it's 100%, 60, 40. This is where all the work is taking place, and it's being held up by this surface one here. You can actually change these as it's going. So I'm going to take this surface one and I'm going to push that all the way down to 1%. And then you can see that we're just about going through the V95, 95%. The way we'd like to have it there. So I think that we have very likely a perfect optimization here. See how long that took. Now we can also evaluate this right now to see this is that channel 1, and it was sort of toward the skin and sort of posterior. And here are the dwell times. There are 3 of them that actually have positive dwell times. Right about in the center is where it's the most. Number 2, which was also toward the skin, but toward the head a little bit. 2 of them with actual dwell times. This is the one that's toward the chest wall, but up a little bit, and only one position got activated here. This is toward the chest wall and down a little bit, and a few trivial dwell times, and just a little bit in the center channel. So let's look at that in a little bit more detail here. I've got that stopped. Whoops, I got that stopped. I'll apply the dwell times. And we can look at our distribution here. Now, generally, when I look at the distribution, I try to take the PTV eval and show that as a segment so that I don't confuse it with the isodose lines. Let me turn the doses off for a second here so you can see what else is going on. Brachyvision, by default, will create this structure, which is called normal tissue, which is a wall extraction on the outside of the target of the plan. In this case, the target was that PTV surface, the PTV eval. There'd be another segment of this inside the balloon here, and it'd be total nonsense. But some people don't like to do a surface optimization, and instead they'll use this approach, and they can take this structure called normal tissue, which it isn't really. All of this is normal tissue, and they can place objectives on that. That's really the same as placing the objectives on the surface of that PTV surface. So I'm going to turn that off because I don't like to use it. And I'll put the PTV eval back on here. And I'll put the doses back on. And let's just have a look at what we've achieved here. The 100% isodose line here, we want this to cover the PTV as well as possible. And you can see in this view it's covered it quite well. Of course, we've covered a little bit more than we need down here. But since we did not define this as sensitive tissue, it didn't try to optimize that away. And you can see we're a long way from the ribs and a long way from the skin. Likewise, in this view, 100% isodose here conforms really quite well here, even though our PTV is slightly irregular here. In the transverse view, in this case, there's a little bit here, but whether or not this is significant, we need to check the volumes instead, and we'll use the DVH for that. But in general, this one looks pretty good. I also put in the 150% and 200% isodose lines because these correspond to that V150 and V200, and you want to evaluate whether or not those encompass a large volume of tissue. Again, we will do that quantitatively with the DVH, but you also want to see where you're creating the V200 and V150, and also you want to see if those ever go outside the PTV eval in breast tissue. Because if we were close to the skin here and the PTV eval was coming in here, then if the 150% isodose line goes outside the PTV eval under those circumstances, then we can't evaluate the V150 using the PTV eval. We have to use that other structure that we created, which is this V150 structure. And I haven't done that yet, but we can do that with the DVH. So I'm going to turn the DVH on at this point. It's in the plan menu. And by default, it will calculate the 3D dose for that. And I'm going to make some changes to this. I like to show it on a white background. When I'm really looking carefully at it, I like to take it full screen. And then we'll decide which of the structures we want to have DVHs for. Certainly the PTV eval. In this case, we'll take the V150 also, and the skin max, and the ribs. And those are all the structures. So the first one, I put the PTV eval here in a bold line here, so it's easier to pick out. We're going to look first at our coverage. So for coverage, we need to have this percentage here and relative dose here. The scaling is not very good in this particular case, so let's zoom in on it a bit. We want to zoom in on the area up to about here. There we go. And then we'll turn on the crosshair so that we can interrogate the graph itself. Now, let's have a look here. We're at 89% dose. We need to be 95% dose, so let's, there we go. Okay, we're about 95% dose here, and we have 93% coverage of that. So we would like to have just a little bit more than that. We would like to have this at 95%, but we know that we're close there. If we want to look at the V150 and V200, those are in absolute, so we'll change this to absolute volume here for those, and turn my crosshair back on. Oh, and I have made a major mistake in my construction here. You can see that this V150 volume has volumes that are higher than the PTV volume, even at the very high doses. And I know that these should converge up at the high doses. What this means is that when I created that, and you were watching me, you didn't stop me, I forgot to subtract the balloon from that. So this is all bogus. This is at V150. But I know in this case that it's not relevant because they should be identical. So I'm going to turn that off for right now. I did that on purpose just to show you that issue. But let's look at what the V150 is here. Okay, we're at 149.7%, at 22.6 cc's. And remember that the V39 says a maximum of 50. We say keep it under 30 and as low as you can get it, and this is a pretty good result. At the V200, we like to keep it under 10. We'd love to keep it under 5. Let's see what we got here. 4.66, not a problem at all. We can allow these to go up a little bit in order to increase our coverage. Now, when we evaluate the skin and the ribs, let me zoom in again to show these a little bit better. What we would like to do, the way I generally treat these, see, I've got my crosshair shown. I've got my crosshair. How come, there, turn that off. What I want to do generally is to evaluate those at the highest dose within those regions, and we can't take the absolute highest dose because it's not very accurate. And so what we do is we take about 0.1 cc and assume that as a maximum real dose to any structure. So if we click on here, we can see at this level we have 0.4 cc's, and this is for the ribs. So what I'll do is I'll just drag this over until that says 0.1, as close as I can get to 0.1. like that. And so here's the maximum rib dose. It's 71%. This is not even interesting. It's so low. Let's try the same thing with the skin. And we'll drag that over here till we see 0.1 cc over there. And we have 60.7%. Again, in this case, it's not at all challenging. These are not going to be limiting us in any way. So we would like to make a little bit of adjustment in this plan just to get slightly better coverage, but we don't need to do anything more beyond that. Okay, so we've decided that we want to get a little bit better coverage here. So what I did was I took this V150 marker and I just moved it up. Let's have a look and see what I did. From 30% just to 33%. And we'll restart the optimization. It'll only take a few seconds. And we'll just stop it right there. And you can see that, that we've got slightly more coverage here. Now these DVHs are created from the points that have been generated from optimization. And they're not complete point sets. As a matter of fact, this one, for instance, on the surface, is actually a dose surface histogram as well. It's not exactly the same. So you can't quite take these to the bank. They are rough guides. So even though we're showing about 96 or 97% here, it's probably not quite that good. But these are a rough guide, and having the markers in here is just a crutch while you're doing this. So I've just moved that up just a little bit to relax this constraint, this objective, excuse me, not a constraint, just to get slightly better coverage there. We'll apply that, and then we'll go back and look at our DVH again. We'll go full screen here, redo the calculation. Okay, relative dose, relative volume, and then turn the crosshair on. Here's 95% here, and if I examine it there, we have 94.6% dose, 95.7% of the volume. This is what I would consider to be a perfect optimization. I'd be very happy with this. You can see also that that the skin dose and the rib dose are well below our prescribed dose in this case. They're not even an issue. The V150 and V200, we'll have to go to absolute volume to evaluate those and see what they are. 150. And that's 24 cc's. You see that's slightly higher than what we had before, well within adequate guidelines. Here's 190, I'll see, exactly 2. And we're at 5 cc's. Great. So I would say this is a very good plan. This is something ready to go to the radiation oncologist for the final approval. So there we are. This is a simple case, and it really isn't very hard to get all the parameters to be very close to what you would choose. So we're going to stop at this point, and we'll go on, start again with the next